Make a start now. To everybody here and everybody who's new, I think I can see a few new people here as well. Welcome. For those who don't know me, my name's Dippin. I am the Head of Professional Services at PharmaPlus, and it's a pleasure to welcome you here to this webinar. This is a monthly webinar that we do for counter assistance. This particular one is aimed at counter assistance and possibly regs as well. We do another one in the evenings for pharmacists, so you're welcome to attend that one as well if you want to. Unfortunately, the one for this evening, as you can probably see here, is actually being cancelled. There has been a personal issue that has arisen that I'm not going to be able to make it on that particular day. I only found out this morning. So I do apologise now for that. And we will be issuing we'll be issuing the date very shortly in terms of when this is going to take place. It's likely to be next Tuesday evening. So again, if you want to, feel free to pop along to that as well. Again, for those of you who haven't been here before, these webinars are recorded. If you do miss something, you can always pop onto the website and have a look at the webinars down there. And there are plenty of there for you to be looking at. So if you do miss something, again, feel free to do that. The particular way I do these, and you'll see how it works, is I do it in a mind map structure. And you can see it here. And the reason for that is it allows me to present a lot of information fully, and also from experience and my teaching experience as well, it helps people to remember. Oops, I'm going to mute everybody. Sorry about that. Okay, that's better. It helps people to remember it as well. So this particular mind map, again, is actually being preloaded on the website. So if you go on there under clinical mind maps, you'll be able to download this mind map, and if you want to, you can even attach it onto your pharmacy wall if it helps you, or do whatever you want with it, really. So so hopefully that's a bit of an introduction. There's plenty of other information out there, so have a look at that. Now, I'm hoping that all of you are here today because you've seen the title of the webinar, which is the danger symptoms in the pharmacy. Last month we did a webinar based on question techniques, and this is an offshoot of that particular webinar. It relates to it, so some of the things that you've learnt last month will be applied into this particular webinar as well. For example, some of the questioning techniques that you will get you ask the patient what types of symptoms the patient has, and from that you can make an assessment of whether or not it's an appropriate thing for you to either recommend something to your patient, or if you're not very comfortable with the idea of recommending for whatever reason, then either that you could refer it onto the pharmacist. So, sorry, wrong one. Where is it? Here we are. The rule of thumb here, in other words, what you want to do, if ever you are unsure of something to recommend, you refer it onto the pharmacist. That's the general rule. So if you're not sure, first of all, recommend you see the pharmacist. And I'm sure that I'm teaching you to suck eggs here, but you'll be surprised at the number of people who've tried to do things which are outside of their realm of expertise. So don't be afraid to refer on if you're unsure about anything. If you remember, last month we went over a number of different questioning techniques. The main ones that we went over were the WAN technique and the as method technique. Both of these techniques ask not questions, but the two main ones that they ask are, well, the two major ones that they ask, not the main ones, they're different ones as well, but the two main things that they elicit is what medication the patient is on and what are the symptoms, and we'll be building on this at the moment. So, for example, if a patient comes into your pharmacy, says, I've got a cough, you may want to ask, well, what medication are you on? And you also want to ask, well, apart from the cough, are you feeling anything else? How long have you had them for example? And can you describe the cough for me? Those sorts of things that you'd want to ask. The mnemonics here are a very useful way of remembering that, and the two things that we'll be concentrating on are these two here. The main one we'll be concentrating on today is what are the symptoms. Now, before we move on, by the way, I forgot to mention that we're likely to finish up in about 20 minutes, so it's not going to be the full 45 minutes. I always put that down just in case we run over a little bit, but we'll probably be over in about 15-20 minutes. Now, what are danger symptoms? Well, danger symptoms generally are symptoms that, as the name suggests, indicate a dangerous ailment. In other words, something which you would want somebody with a little bit more expertise to actually assess and make a judgment as to what to do next. So, for example, a pharmacist would want to refer somebody onto maybe A&E or even a GP if what the patient is suggesting is outside of the pharmacist's expertise. You, in the same way, would refer to the pharmacist if you are either unclear about what to recommend or if you suspect that something is going on in the patient that may need somebody with a bit more expertise to look at. So basically, it's a symptom that could indicate something which is dangerous. All right, and also symptoms you need to be a little bit more alert. So if a patient comes to you and says, "I've got a bit of a pain in the chest," that should immediately ring alarm bells with you. So it would mean, for example, that you would refer it straight on to the pharmacist. You probably wouldn't even ask the patient any more questions. Say, "Look, I'm just going to get the pharmacist for you." And actually, well, technically, yes, the medical symptoms. What I've also included in this webinar is a very short bit about drugs of abuse here as well. And other things that you need to be very aware of in the pharmacy. They're not actually symptoms that the patient demonstrates in the terms of medical symptoms, but it is still something that should alert, or you should be very alert to every single time you sell a medicine. The two things that will be going on today, and are two different things really, okay? First of all, it's the warning symptoms, the sort of symptoms you want to be aware of in the pharmacy. And the second thing is the sorts of drugs you want to be alert on if a patient comes to you either on a regular basis or you feel may not necessarily be appropriate for because of their addictive properties. So that's given you a little bit of an introduction. Now, be warned that the next branch that I'm going to open up has got a lot of information on it, and I certainly don't expect you to remember it. That's the whole point of you being able to download this mind map and print it off and maybe put it in your pharmacy where you can actually see it. So please be warned about that, but we do need to go over it, so I don't apologize for that reason. Now, these warning symptoms are the most common that you're likely to experience in the pharmacy. By no means are they the only symptoms, so you need to use your initiative. You may need to read around the subject a bit as well, but these are the main sorts of things that you want to look out for and refer immediately onto the pharmacist if you experience, or the patient tells you that they experience something like this. At ease, what I've done is I've sort of like broken it down into various areas, and you'll see it's not complete. I'm sure you'll be able to think of a few more that I haven't put down on here, but these are the most common ones. So let's look at the chest symptoms, okay? So remember earlier I mentioned something about chest pain. This one here. It could be quite simple. It could be something as simple as, for example, a person's been coughing a lot and therefore his chest is a bit tender. Could, I'm sure you're probably well aware of the fact, mean that it could be angina, for example, a heart condition. Worst case scenario, it could even be the start of something called a myocardial infarction, which is a heart attack. You know, there's loads of different things it could be. So chest pains really are things which you really ought to refer on to the pharmacist if the patient complains about that, particularly if they are in, say, for example, over 55 or so, the first time they've had it. Again, it could be something as simple as indigestion. You don't know, but they could indicate something a lot more serious, as I've just explained. And there are other things that you ought to be aware of here as well. Short of breath. Well, it could simply be that the person's been running a lot, or it could be, for example, asthma. It could even be heart failure, for example, as well. Again, difficult to assess which one unless you get somebody else to look at it, somebody a bit more experienced. Same sort of principle with wheezing. Almost always means that there's a circulatory problem going on. Again, that would probably mean a referral onto the GP. In actual fact, the patient will probably be referred on by the pharmacist. But again, something that you need to be aware of. And on here are obvious ones. Blood in the sputum, and I'd be very surprised if you just stand there and recommend Benylin for chesty coughs of blood in the sputum. That's not going to happen. Again, I'm teaching you to suck eggs. Palpitation, so that's basically a very strong, possibly irregular heartbeat. Again, the patient could have been running. Again, it could be indicating something a little bit more serious. It could be several types of heart conditions that could exist. One particular one could be atrial fibrillation, which is an irregular heartbeat or a very faint heartbeat. And if left undetected, it could indicate things like stroke, etc. So again, something you need to be aware of. And the other ones as well. So for example, persistent cough, whooping cough, or croup. These three are sort of like similar. Again, persistent cough. Say for example, a cough that's been going on for more than 2 weeks. You ought to refer to the pharmacist. The sputum is coloured. That could indicate a number of things. Probably would indicate an infection of some sort, which would probably require a referral onto the GP. It require antibiotics, but the chances are the GP themselves probably wouldn't prescribe it for that instance. But again, it's something that you wouldn't be able to treat in the pharmacy. So summarizing, again, I'm sure you'll be able to think of other things. In the chest, there's quite a few things. The main one really is probably chest pain, palpitations, blood in the sputum, wheezing, and that's probably the main ones that you might experience. This here you probably experience quite often. You probably get a patient coming in saying something along the lines of, I've got green phlegm coming up, in which case you really ought to refer it onto the pharmacist. So these are the warning symptoms, and remember you can print these off, so bear that in mind. Gut, you probably will get a lot of patients coming in for gut-related symptoms, nausea, vomiting, and also like stomach aches and pains. So these are sorts of things that you ought to be aware of and refer straight onto the pharmacist if you experience it. For example, difficulty in swallowing. That indicates simply a sore throat. Could indicate something a little bit more serious. Probably a blockage. Worst case scenario could even be a cancer of the throat or something like that. Again, refer to the pharmacist. Here, I'm sure again you're not going to really sort of like stand by and not refer anything to do with blood. Really, we should be referred. Now, this is an interesting one. Vomiting with constipation. Now, what that could indicate is a blockage somewhere along the gut. Basically, it can't get out, so the only other way it can go out, so you can't get out one end, so the only other way it can go out is through the mouth. And especially if the vomit smells a bit like feces, then that is an immediate referral. So that's something you need to be aware of. And the two other things, main ones really, these things here, to do with weight loss. Now, unexplained weight loss or massive short-term weight loss are signs of referral. It could be something simple as a very strict diet, or it could be something a lot more serious, start of maybe some sort of cancer, or something along those lines. All those things should be referred. Also, I suppose what I should have really put here, rather than diarrhea, actually, let me put it on here. It'll be diarrhea for more out 2 or 3 days. Okay, so that could indicate dehydration starting to set in, lose too much water. So all these again potentially quite quite dangerous signs. Now, look at the eye. Again, I'm going to mess about with the eye. I'm sure you're well aware of the fact of how important this particular organ is. Most likely symptom you're likely to come across in the pharmacy is that of conjunctivitis, which is a sticky eye. A sticky eye that's not painful, that they can see properly, and they might, especially get the lids get stuck together in the morning. So, seeing the fact that that's simple infective conjunctivitis, you're unlikely to experience any of the following with something like that. That the eye is painful in any way, you need to refer it onto the pharmacist. In actual fact, the pharmacists themselves would probably immediately refer it onto A&E or to the optician down the road. There's nothing in the pharmacy that you can give for a painful eye, and a painful eye would indicate probably something that is quite serious. Must be anything like this, any double vision. I mean, apart from the fact you might, you might be drinking or something like that, and you might be experiencing double or even quadruple vision because of that. I don't mean that, but say for example, if you're experiencing double vision, it could mean that there's pressure on the eyeball. It could mean other a little bit more serious indications as well. And if you loss or blurring of vision, I mean that is deadly serious. I mean that would probably require an ambulance being called over and being carted off to A&E. So bear in mind the fact that the only thing that you should be prescribing for, apart from dry eyes and conjunctivitis, those are the two things that you should be giving things out for. Any one of these symptoms would probably require an immediate referral to accident emergency, or at the very least onto the GP. The other ear. Again, only sorts of ear remedies that you're going to be likely to give out in the pharmacy is something for earwax. So there's a build-up of earwax, that's something that you might not need to give, or called ear calm, I think, which is a solution of something called acetic acid. It can be used for very, very minor external infections. It's very good, but and I certainly don't recommend it generally to my patients. But those are the only two things you should be giving stuff out for. So if anybody really describes the fact they've got a very painful ear, referral to the GP, referral to the pharmacist. Earwax in general won't cause pain. It might cause a bit of annoyance, but it shouldn't really have a significant effect. Any discharge coming out the ears could indicate an infection of some sort. Again, immediate referral. Obviously, deafness. I mean, if you can't hear, you're not going to be able to do anything in the pharmacy for that. Again, it's a referral again. Tinnitus, now that's a ringing inside the ear. It could indicate something wrong with the eardrum itself, or something wrong with the pressure inside the ears. There's nothing you can give for that. It's a referral. And vertigo, I think it's with an I there, so I spelled it wrong. That's dizziness. It can be accompanied by nausea. In actual fact, the ears themselves contain the balancing mechanisms of the body. And that is affected in any way, you're going to start feeling quite dizzy, you're going to start feeling sick as well. Very similar to, say, for example, travel sickness. That can be affected as well by that. So anybody who complains of vertigo in that way, dizziness or sickness in that way, and especially if it's accompanied by any one of these symptoms here, is a referral onto the pharmacist. And that the other most likely one that you're likely to get in the pharmacy is the genitourinary issues. In other words, problems down there. That's what I generally tend to call it. The most likely issue that you're going to be given is probably along the lines of cystitis. You know, a woman coming in with burning in the urine, which tends to be caused by short-term infections. Which can be treated generally by I think sachets that you can give out in the pharmacy. It tends to go away by itself, or if it's worse, it can be simply treated by a simple course of antibiotics by the doctor. But what I've noted here are things that can indicate something a little bit more dangerous. So, for example, this difficulty in passing urine. That could indicate, actually these two, for example, are interlinked. So difficulty in passing urine and abdominal, loin or back pain with cystitis. These could indicate either a blockage in the mechanism behind passing urine, Or, worst case scenario, it could actually indicate a kidney infection as well, and especially if the patient comes in with cystitis and a cake, that's quite serious. I mean, that would probably require a GP's intervention quite quickly. That would indicate possibly a kidney infection, or possibly even a renal stone, or kidney stone, I should say. Blood and urine, again, you know, anybody who's got half a brain, I'm sure you have there as well. You're not going to stand idly by while somebody passes blood and urine. Temperature with cystitis would indicate an infection. Unlikely to give the shays at this point. You will probably require an antibiotic at this stage, especially if it's accompanied with temperature. Temperature with cystitis, especially if it's accompanied by abdominal and back pain, that's quite serious. You're going to need to refer those two. Urine discharge and bowel discharge, you know, in any normal situation, you're not going to get discharge coming out. I suppose with discharge, what I meant here was a bloody discharge, and not sort of like the sort of discharge you would get from thrush, which is just sort of like a creamy type discharge. What I meant here was probably either green in colour, or possibly even red, which would indicate blood. And that's probably what I meant by that. This is a medical emergency. Vaginal discharge, so not discharge, right, vaginal bleeding in pregnancy, that could indicate a potential miscarriage occurring. So, you know, that would require, forget about referring it on to the GP, you know, that would require 999 call immediately, and a referral on to A&E. And here, men with cystitis, it's unlikely that, so men do get the cystitis, believe it or not, but it's more uncommon for men to get cystitis, simply because of the way in which they're plumbed up together. So if man does come with cystitis, again, it would be a referral onto the GP. You'll probably require antibiotics for that. So again, very simple things here that you need to be aware of. Again, they're not all inclusive. If I did, it would take a lot of time to actually write that, and time which we haven't really got. Now, the last thing I've put in is other. Now, some things you really want to be aware of. They tend to be rather uncommon, but you really ought to have it in the back of your mind. So, neck stiffness, especially if it's accompanied by a rash of any sort, or by something called photophobia, which is a dislikening of light. Not like vampires, but they can't seem to focus on strong light very well. That could indicate meningitis, and that's something you need to aware of, especially a rash which doesn't go away when you put a glass onto it. Persistent vomiting, you know, especially if it's gone on for more than a day or two. And what I mean is persistent every hour or two, you're going to end up becoming very, very dehydrated. And again, that's something you really ought to refer on. And these two, any form of head injury or any form of injury which leads to a loss in the mobility of a particular limb, could indicate maybe a fracture. It could indicate even a breakage, although it's very unlikely that somebody's going to come into your pharmacy with a breakage there. And last of all, in this particular selection of things, anyway, is travellers. So especially if they've gone into the tropical areas, they come back with illnesses, especially ones with fever. You need to refer on. I mean, they could be something as simple as a common cold, or on the other hand, it could be other more serious conditions like malaria. Is a very common example here as well. Hopefully, I thought I've explained to you the very common types of danger symptoms. Not common, but the most common danger symptoms you're likely to experience in the pharmacy, coming from the chest, the gut, the eye, the ear, and the genitourinary system as well. And there are a few other ones as well. Now, that's, as I said, no, but in no means is it all inclusive. There are going to be other things that I've missed out, but these are the most likely ones that you're likely to experience. How are we doing for time? Let me just have a quick look. Bear with me a minute. Let's see how we're doing. Okay. We've got a little bit of time left. Okay, so we've still got. Okay, now I'm going to go on to another area which you need to be aware of. We've talked about warning symptoms, in other words, symptoms which you need to be aware of that a patient may demonstrate. However, you are in charge of a number of different drugs that could potentially be abused in the public. And whenever you sell a particular drug, you need to ask yourself some questions, really. And I sort of like summarize a few things that I always ask myself. Is the patient a known or a suspected addict? If the patient is, then really refer it on to the pharmacist, and you'll see why in a few minutes, why I would say that. Are they regular buyers of the same medication? In other words, are they coming in every other week or every other day for the same sort of medication? I, for example, have had to say no to people on laxatives, on patients who are addicted, for example, to Nurofen Plus, because it contains codeine inside it, and you'll see why in a minute. If they're coming on a regular basis, that alarm bell should be going off in your head. Why are they coming in every single week? Is it because of the fact that they've got something more serious underlying that issue? So, for example, if they're coming in for a headache tablet every week, why coming in for it? What's the reason behind it? Are they showing something which they really ought to be seeing the GP about, or that they potentially could be addicted to it? Now, is the patient asking for that medicine? Is the patient asking for medicine that has a risk of abuse? And we'll go over a very small list of drugs in a few minutes that you really ought to be aware of. And the other things that you need to be aware of, is the patient any influence of any sort of alcohol or drugs? And you'll be surprised. You will come up with people who have a bottle of beer in their hands, obviously stink of alcohol, and asking for various medication. Normally what I'd say in this instance is go away and come back when you're a bit sober. And the other thing you need to be aware of is the patient unusually incoherent, or is he displaying unusual behaviour? In which case, it could indicate somebody who may be under the influence of alcohol or drugs as well. And these are patients you really do not want to, especially under the influence of alcohol or drugs, you really do not want to give anything to them until they are sober or they're relatively clean, because you don't know how many they're going to take, you don't know what they're going to take either, and it's not safe for them, really. The sort of things you ought to be aware of, let me open up this one as well. These sorts of drugs, and then again, this is not a complete list, but they're the most common sorts of lists that you're likely to experience. Laxatives. A lot of women, and especially in actual fact young women, I should say, actually fact young men even do it as well, but mainly as young women, use laxatives to try and lose weight. And you can probably imagine that if you use laxatives on a long-term basis, it's going to create a lot of damage inside you. It's certainly not healthy, and it's certainly going to create a lot of long-term damage. And actually, if people are buying excessive quantities, looking at packs of 100 or so, or 60 on a regular basis, you really ought not to sell them and refer it onto the pharmacist. I mean, this is something that a GP will need to get involved in. And I've stopped a few people in my time that I've suspected of being abusers of laxatives and refer them straight onto the GP, explaining why I've done that as well. A lot of the time, these people don't understand what they're doing to themselves either, and a simple explanation from a pharmacist or somebody would just sort of like prompt them to seeing extra help. Painkillers, especially, and I think I should really have put this in these two together. Painkillers, especially those which contain something called opioid-based analgesics. So the most common one you're likely to experience is codeine, and there's also dihydrocodeine as well. So you might get paracetamol and codeine, you might get Panadol Ultra. The two main ones that you're likely to come across. Codeine itself and dihydrocodeine tends to be quite active. They're in the same family of groups as heroin and morphine. So you probably imagine that patients who abuse these drugs are are very prone to buying these types of painkillers. So if somebody does demonstrate it, alarm bells should be going off in your head. So especially if they're buying excessive quantities of these. Another is, believe it or not, codeine as well can also be used for treating coughs. There's another one called Folcodine as well. You can probably see the similarity in the names. The particular ones have the same problems as the painkillers I suggested. So if anybody asks for codeine, it's unlikely that you're going to have it out in your pharmacy now. They're generally, most pharmacies have taken it off from the counter and probably keep it in the pharmacy now. But Folcodine is another one which you need to be aware of, because it's a very. Let me write it down here. I think it's Folcodine. I think that's how you spell it. And the other one is codeine. Codeine. That's how you spell it. I think. Anyway, I can't remember how you spell it. But those two are the ones you really ought to be aware of. Now, recently, pseudoephedrine, not recently, probably about 3 years ago, the MHRA, which is the organisation that sort of like polices the safe use of medicines, limited the amount of quantities of pseudoephedrine that's allowed to be sold. And the reason why they did that was a lot of naughty people really were then using it to then manufacture their own amphetamines. So that's what you need to be aware of. If somebody keeps on asking you for pseudoephedrine, they shouldn't be using it on a long-term basis anyway, because it will cause damage to them anyway. But you need to be alert to the fact that this is something that could be going on. Tablets now, a particularly common one is Nytol. I mean, a lot of addicts will come in asking for Nytol. A lot of patients who have got long-term sleep problems will come in asking for Nytol. And it's certainly a drug that shouldn't be used on a regular basis, because it could cause dependence and you won't be able to get to sleep without taking it. So Nytol or similar sort of drugs to that are ones you need to be aware of. And finally, the two final things we're going to talk about, excessive quantities of medicine. So, for example, if a patient comes in and asks for large amounts of anything, you ought to be aware of as well. I mean, it could be the simplest drug. It could be large quantities of Benylin, for example, Benylin for chesty coughs. You really ought to be on the lookout for something like that, because they shouldn't really be ordering too much. And also, as with everything here, any drug that you prescribe, you need to think about any medication that the patient is already taking. So, coming up with, say, for example, pseudoephedrine, I always give this example. It could cause various issues. One particular one, it shouldn't be used in patients with hypertension or high blood pressure. So if they're, for example, taking any other medication, just check with a pharmacist to make sure that it's actually safe. So that's it. So to summarise, if you are unsure, you need to refer anything. Okay. We went over last week the two different methods, so WAM and AS method. There were a few others we went through, but those are the two main ones. These methods can be used to extract out the different symptoms that a patient can demonstrate and what medication that they're on, but mainly the most used for symptom control. And the sorts of symptoms you need to be aware of are demonstrated here. So in the chest, you've got another one in the gut, another one here in the eye, the ear, the genitourinary, which is cystitis and thrush, and these ones here, neck stiffness, persistent vomiting, any form of injury, head injury or loss of mobility of any sort, and travelling. And finally, we then went over the different types of drugs abuse, the sorts of questions that you need to ask yourself all the time as to, is this patient going to use this medication safely? And finally, we ended up with the different types of medication that you really ought to be looking out for on a regular basis, as to demonstrate a lot more caution when you're giving it out. But that's it for me today. I think we're just about on time. If I see it, yeah, just about on time. Thanks again for everybody coming on board. If you've got any questions, there is a text box on the site. So if you want to ask anything, now's the time to ask. So if you want to type in anything, please go ahead. Okay, it looks like everybody doesn't want to talk to me today, which is fine. I normally get a couple of people actually asking, but no worries. Yeah, again, it's going to be on the internet, so please look out for that. You can download the mind map on our website, and this particular webinar is going to be on the website probably in the next few days or so as well. So thank you very much to everybody. Hope you enjoyed yourself today, and have a really good day in your pharmacy, and remember the danger symptoms there as well. Use that today.
Thank you.
All the best. No problem. Take care now. Thanks a lot. Get out. All the best.